Hi, I'm Darryl Reed and I work for Tissue Repair, and I'd like to introduce our new product TR Pro Plus, which is a hydrogel formulated for the aftercare of cosmetic and medical procedures. TR Pro Plus represents a new standard in aftercare treatment, one which is underpinned by science. In the mid-1990s, Dr. Graham Kelly became aware of the emerging evidence that linked beta-glucans with immune modulation, and he started looking at a glucan derived from yeast while working at the University of Sydney. Beta-glucans are polysaccharides that are composed of individual glucose monomers which are linked together in different ways. Beta-glucans are found naturally in the cell wall of bacteria, fungi, algae, and cereals such as oat and barley. And the linkages between the glucose subunits differ depending on the source, and those from yeast are distinct in containing a linear 1,3 backbone with a 1,6 side chain. Beta-glucans can influence biological activity, and the differences in the shape, structure, and molecular weight determine the level of that activity. While beta-glucans from algae and cereal can affect metabolism, those from yeast and mushrooms have immunomodulatory properties. The beta-glucan used in TR Pro Plus comes from baker's yeast, and we've called this glucoprime. Over more than a decade, Tissue Repair has developed the expertise to purify this beta-glucan, or glucoprime, from the yeast without significantly breaking down the native molecule. And as a result, the mixed group of glucose polymers are large and cannot be dissolved in water. The large structure of the glucan in TR Pro Plus is integral to its immunomodulatory activity, and in being able to purify the glucoprime without significant damage, we've overcome one of the main challenges that has faced researchers looking to develop a glucan product with medicinal properties. When TR Pro Plus is applied to the skin and works its way down to the dermis, it comes into contact with macrophages, which can be considered to be the guard cells. They're continually on the lookout for foreign objects like bacteria and fungi. There are receptors on the surface of the macrophages that recognise the beta-glucan as being foreign. And this recognition kicks off a process of macrophage activation, which not only involves the macrophage engulfing the glucan with the aim of breaking it down, but they also start to produce growth factors and cytokines which attract more cells to the area. And together these cells produce factors that play a key role in skin repair and stimulate the production of collagen. As I said earlier, although beta-glucans have been studied for many years, they are all very different. Even glucans that are purified from the same source can be different in terms of size, shape, and molecular weight. And these changes have a major effect on immune modulation. I've just explained how glucoprime can attach to the surface of receptors and stimulate macrophages to produce chemicals that are favourable to healing skin. However, there are published experiments that show that although smaller glucans can also attach to the receptors, they are not able to activate the macrophages. What this means is it's important to remember that when you read about a product containing a beta-glucan, you should be skeptical unless they can provide evidence to support the skin healing effects for that specific glucan. In 2011, there was a paper published which confirmed that TR Pro Plus was able to activate human macrophages, and that this activation occurred through two receptors called Dectin-1 and TLR2. Additionally, TR Pro Plus activation of macrophages was shown to lead to the production of two specific cytokines, TNF-alpha and interleukin-10, as well as stimulate phagocytosis and the production of reactive oxygen species. It was initially thought that due to the large size of some beta-glucans, they would not be able to be absorbed topically. What has since been shown, however, is that they are able to move through the epidermis down to the dermis, and they do this by moving around cells instead of moving in and out of cells. The photo to the right of this slide shows a glucan that was attached to a fluorescent dye. When it was applied topically, you can see the green fluorescence around the cells, which identifies the glucan. Beta-glucans are also able to stimulate collagen production, which is important for healing, to create new tissue matrix. When TR Pro Plus is applied as a cosmetic aftercare treatment, the collagen also helps in hiding wrinkles and lines. Many people have asked about whether TR Pro Plus has an effect on scarring, and this is a great question. While we don't yet have direct data on this for our product, it's something we're working on with a team at the University of South Australia. However, we can make an educated guess with the information we have at hand. We know that TR Pro Plus hydrates the skin and provides a barrier to reduce water evaporating through the skin. This moist healing environment encourages healthy skin healing. We also know that a similar glucan has been shown to increase the production of two molecules, K10 and TGF-beta3, and we know that when both of these are increased, there's a greater likelihood of normal scar formation. Therefore, we believe that if TR Pro Plus was used daily for 60 to 90 days on new wounds, it's very likely that it would assist the scarring process. Another key benefit of TR Pro Plus is that it's a hydrogel formulation, and hydrogels are one of the best dressings for healing skin because they can stem blood flow and manage exudate. This hemostatic property means that TR Pro Plus can be applied to the skin immediately after a procedure, even when it's been broken and may be bleeding. The gel also forms a light biofilm layer, which unlike silicone gels is only partially occlusive. This means that if it's applied directly after a laser procedure, the heat can escape, and it also allows oxygen to pass freely into the skin to benefit healing. We are so confident in TR Pro Plus being able to assist healing skin because we've demonstrated it at a microscopic level, which is something that most other aftercare products haven't done. In this slide, we see histology samples showing the impact of using TR Pro Plus on incisional wounds at 5 days. Compared to the control and Vaseline samples, TR Pro Plus can increase tensile strength more quickly due to the enhanced influx of macrophages and neutrophils, which enable the tissue to regenerate sooner. We've completed 2 phase 2 studies on patients who had undergone CO2 laser skin resurfacing, and I'd like to share the outcomes of the most recent trial, which was published in 2022 in the journal Dermatologic Surgery. This trial was registered with the FDA and was a randomised double-blind controlled design. 40 subjects underwent the laser procedure on the full chest area and then applied either TR Pro Plus or a placebo gel daily for 5 days. At day 28, an assessment was made on the skin quality using validated scales for wrinkling and elastosis. Compared to the placebo group, those patients on TR Pro Plus showed a 35% improvement in wrinkling and a 40% improvement in elastosis. Both of these were statistically significant, demonstrating that TR Pro Plus can fill out wrinkles and fine lines at an accelerated pace. In 2022, a real-world evidence study was set up to capture direct feedback from patients who had used TR Pro Plus. The program involved 12 dermatology clinics across Australia and included 48 patients who provided anonymous feedback at day 6 and day 28 on a range of procedures. As you see from this slide, there was a broad range of skin characteristics included in the study. The procedures included a mix of cosmetic procedures such as laser, needling and light therapy, as well as medical procedures such as biopsy, skin cancer removal and dermatitis. Patients were asked about how they felt about their skin recovery, and 81% rated themselves as being happy or very happy. In regard to their perception of how they felt their skin was healing, 85% felt it was healing well or very well at day 6 and day 28. And when the group was asked about their experience using TR Pro Plus, 81% were satisfied or very satisfied at day 28. Many people made positive comments about the texture, biofilm and absorption into the skin. And of the people who had had prior procedures and used other products, 100% said that TR Pro Plus was as good or better than those other products. Although TR Pro Plus has only been launched recently, we have some outstanding case studies that demonstrate the effectiveness across different procedures. This patient underwent a fractional laser skin resurfacing treatment and in a split-face design applied TR Pro Plus to the left-hand side of her face and another Aftercare product to the right-hand side. After 18 hours, you can see the skin has less redness and does not have raised grid marks from the laser on the side in which the TR Pro Plus was applied. This patient underwent a needling procedure and applied TR Pro Plus immediately afterwards and for the following 2 days. The cooling and soothing properties of the hydrogel were apparent to the patient straight away, and by day 2 she felt that the recovery was far superior to what she had experienced previously. As with laser treatments, the effect of needling is enhanced due to the creation of channels in the skin, which allows more of the TR Pro Plus to reach the dermis. This patient had a Morpheus 8 RF needling procedure, and in as little as 1 hour the effects of TR Pro Plus were apparent, with less visible redness. The patient reported almost instantaneous cooling and soothing that reduced the pain and tingling compared to other procedures. Let's take a look at some of the benefits following medical procedures. In this case, an 83-year-old man had a BCC removed from his lower leg. Given his age, the skin was very thin and developed an infection which was treated with topical, then oral antibiotics. By day 3 of applying TR Pro Plus, the inflammation around the scab had receded, and by day 5, there was very little scab left and the skin looked healthy. This case involves a lady who received a superficial burn to her hand. By day 2 of the treatment, the wound was looking far less inflamed and well on its way to healing. And TR Pro Plus has also been shown to be beneficial for people who suffer from dermatitis or where skin cancers have been excised, in which case the gel can be applied immediately after suturing. This was a lady who had received a head wound and who applied TR Pro Plus daily. By 7 days, you can see that there is barely any evidence of damaged skin. I've shared some information about the glucoprime active ingredient in TR Pro Plus and how it can work to modulate the immune system, which in turn can assist the skin to heal better and faster. The results of a phase 2 clinical trial have validated this through a robust study design, and the real-world evidence study provided first-hand patient feedback on a range of cosmetic and medical procedures. Several case studies were then presented which validated the prior research. The benefits that are provided by TR Pro Plus are broader than for any other aftercare product currently available. The hydrogel and glucan can provide deep hydration by attracting water from the deeper tissues. The hydrogel film protects against infection and reduces loss of water through the epidermis. Being semi-occlusive, the barrier still allows heat to dissipate and oxygen to transfer across the skin. The cooling and soothing effect is immediate, and even following more superficial procedures like light therapy can reduce redness, tingling and irritation. The hemostatic property enables the gel to be applied directly on broken skin to stem any bleeding. Other aesthetic properties include an antioxidant capacity to combat free radicals produced by UV radiation, and increased production of collagen to bulk skin and hide fine lines and wrinkles. In terms of application, TR Pro Plus can be applied directly after the procedure and then daily for at least the next 4 days. Longer treatments will produce a better result, and if used for 60 to 90 days may reduce scarring. The 10% ethanol content may leave some people feeling that their skin is dry, which is why we suggest TR Pro Plus to be applied in the evening before bed. It can be washed off in the shower the next morning, and moisturiser or sunscreen can be applied liberally throughout the day, so there's no reason the skin should be dry. For procedures that involve breaking the skin, the TR Pro Plus should be applied like a mask at a thickness of about 1 to 2 millimeters. For more superficial procedures, a thinner layer can be used. Thanks for listening today.